So the study was Cancer Awareness and Attitudes among the Traveller Community in Ireland, a co-designed research project in collaboration with the Traveller Community. And I will show the full team members afterwards a little later. But just first of all, just thank the NCCP for funding the study, and also the Royal College of Physicians in Ireland for granting ethical approval. So briefly, we'll present our co-designed research process and the key findings, a little bit on the background, why was it important to address cancer awareness and attitudes among the traveller community in Ireland, our study aim and objectives. I will go through those very briefly and then focus a little bit on the key findings. So this was the research team. Just again to note that it was a collaborative project with Pavee Point Traveller and Roma Centre. There's Dr. Lindsay Kavanagh and Mary Bridget Collins, and our colleagues, as you know, here in the NCCP, and our colleagues in UCD. So in terms of the background, the traveller community is a distinct minority ethnic group. This was recognised in Ireland since March 2017. In the last census, there was almost 33,000 Irish travellers living in the state. That was less than 1% of the population. And 4% of the traveller population described their health as bad or very bad, twice as high as the general population in that census. Many of you will be familiar with the All-Ireland Traveller Health Study, which was undertaken in 2010, and a lot of the data that we have around travellers' health and experiences come from that study. So we know that travellers experience poorer health outcomes and lower life expectancy relative to the general population, with approximately 1/5 of deaths caused by cancer. Travellers have reported significantly poorer quality healthcare experiences, and also experience high levels of discrimination, which negatively impacts their health status and use of health services. These were the various policy documents that underpinned our study. Again, that's the All-Ireland Traveller Health Study, the first one there, and of course our National Cancer Strategy, which very much focuses on the importance of prevention and being mindful of and taking into consideration deprivation, and also further studies that looked at presentations at a later stage for cancer due to people not being able to access services. So the overall aim was to gain an understanding of cancer awareness and attitudes among the traveller community, and to identify any barriers and enablers to cancer risk reduction behaviours and early diagnosis of cancer, with the overall aim of reducing morbidity and mortality due to cancer among travellers in Ireland. I've just highlighted there that what we were looking at was knowledge and or awareness of risk factors among the traveller community, also looking at beliefs about perceived risk factors with no known association with cancer development, looking at knowledge and or awareness of early signs and symptoms of cancer, and also in relation to cancer screening. So the focus really was on prevention, screening and early detection. We also wanted to identify health information sources used with reference to perceived or established risk factors for cancer and signs and symptoms of the disease. We had a few more objectives, so we had 9 in total. The first ones that I mentioned there, they were to, we were meeting those with the survey because it was a multi-methods project, and the last few here we used interviews which were conducted with healthcare professionals and also with travellers to achieve these objectives. So to assess health-seeking behaviour and factors that impact this, including barriers and enablers to accessing health services and engagement with cancer prevention and risk reduction behaviours. To assess the impact of the social determinants of health on health-seeking information and behaviour. And this was a very important aspect that we really wanted to use as a guiding principle. And it certainly, this came out very early on in our discussions with Pavee Point. and to explore the perceptions of healthcare professionals and cancer screening professionals regarding the barriers and enablers for travellers when engaging with the health system. So this is where we are in the process. We're at the draft final report stage. We're almost there. We're just finalising the data. Well, the data has all been analysed, but we're just finalising our write-up of the report, and some of the findings that I'll be presenting later on in terms of the themes, we may need to do a little bit of final tweaking on those, but we will be able to present largely the main themes that are coming across. So what was very important in the beginning was the co-design nature of this research, and we worked very closely with our colleagues in Pavee Point in relation to ensuring that the NCCP Cancer Awareness Survey and the cancer awareness survey that you heard about this morning, that we had that modified to ensure that it was appropriate and culturally sensitive. And we got a lot of great feedback back through a number of training sessions that we held in Pavee Point in relation to how to make it clearer and to use wording that just would be more appropriate. So we learned a lot in those training sessions, and in fact a lot of the discussions that came through later actually in the research, certainly through the qualitative interviews, which was reassuring. So for the survey itself, we set out to survey 380 travellers in total, and we got 483 surveys completed. Thank you to the ladies and all of their colleagues across the country. So never before have I been involved in any research where you've come anywhere close to reaching your target survey number, let alone exceeded. So we were really delighted with that. So it was 127% of the target. Approximately 2/3 were females and 1/3 were males. And we then actually it's a little bit further along there, but the surveys with the healthcare professionals were undertaken first. So we conducted 15 interviews, I should say, semi-structured interviews with healthcare professionals, 5 GPs, 6 public health nurses, 2 general practice nurses, and 2 screening healthcare professionals. And we'd just obviously like to thank all of those who were involved in the interviews, both the healthcare professionals, because they were incredibly busy, and the travellers who took out the time out of their day to take part in the interviews. So we ended up with interviews with 22 travellers in total. There was 2 sets of interviews where there were 2 people were interviewed at the same time, but we were delighted with the participation. And just to note that the travellers who were interviewed had all actually taken part in the survey. So in relation to our the training and across the country, we undertook training, a total of 8 sessions in total, with the primary healthcare for traveller projects around the country, and about 3 to 12 traveller community health workers attended each session. So these were the people who undertook the research. We couldn't have done the research, we wouldn't be here today if it wasn't for those traveller community health workers who actually went out door to door, went to each person's home and undertook the survey with them. So it's a long survey for people who might not be familiar with it, and a number of questions, and as was illustrated earlier, some of them, included prompts and some spontaneous. So it was tricky enough one to complete. So we're very, very grateful to all the traveller community health workers. As I said, we couldn't have done it without them. As you can see, we had a little bit of around the world in 80 days. I hadn't been on the train as many times over the last 20 years as it was in that year, but it was lovely to go around and visit all of the different projects, and we got a lovely welcome wherever we went. The scones and the tea and coffee were ready for us. So those are all of the different projects that had taken part. in the survey. So we delivered the training, and then we made ourselves obviously accessible afterwards if there was going to be any questions. And Nancy and Helen and Mary will come in and talk about that a little bit later in relation to their experience. Just in terms of the results, so the profile of respondents, as I said, there was almost 2/3 women and almost 1/3 men. In relation to the age group, it was 18 to 44 were the primary age groups that participated. And overall, we had over half from the Leinster region. And of those who actually participated in the survey, over 1/3 actually had been diagnosed with cancer themselves. And at the time of the survey, 3%, or about 5 people, actually were on treatment. So again, very grateful to those people for taking part and sharing their views at a time which was clearly difficult for them. So just a little bit in relation to the survey results in terms of the attitudes to cancer. 60% agreed that many people with cancer can expect to live with normal activities, can continue, with normal activities and responsibilities. 70% believed that cancer can often be cured. 40% believed that a diagnosis of cancer is a death sentence, so that was a little bit higher than in the general population. Almost 1/3 would not want to know if they had cancer. However, almost 80% agreed that there are things that they can do to reduce the risk of cancer, while approximately 10% disagreed with that and 5% said they don't know. Older people in general tended to hold more negative views about cancer and were less likely to believe that there were things that they could do to reduce their cancer risk. So that was around 70% for people over 65 versus 86% for people in that younger age group. And I believe that was similar in the general population as well. More than 80% recognised smoking and the use of sunbeds as risk factors and identified the importance of limiting sun exposure. And I obviously couldn't put in all of the results here, but there was very good in terms of using sun protection. There was a high proportion of people who actually used sun protection, particularly for their children, and that was something that came up again when we were travelling around the country and having those discussions. Just over 2/3 recognised passive smoking as a risk factor. Overall, women had a better understanding of smoking and cancer risk. There was a little, slightly lower proportion of people who recognised environmental factors like pollution and asbestos and radon exposure, and slightly lower levels also for physical activity, eating red and processed meat, and too few fruit and veg. And whole grains were less likely to be recognised as risk factors. So that was recognised by less than half. About 20% recognised whole grains or lower whole grains intake. Almost 2/3 recognised alcohol as a risk factor, and just over 2/3 recognised the role of genetics. A few things with no strong evidence of causing cancer were identified. So those were things like stress, mobile phones, vaping and aerosols. And again, I think that was something that came through in the general population survey as well, that there was about 3/4 of people, I think it was even 80% in the general population, determined or believed that stress is a risk factor for cancer. Just to say, the percentages above include combined spontaneous and prompted responses. I think that sometimes some of the questions, you know, if any of us were asked on a given day, depending on how tired we are or not, or the beginning of the day or the end of the day, sometimes I think even though it's in there, it mightn't come out straight away. So just combined it for those. Just in terms of awareness of cancer signs and symptoms, overall there was good awareness of the warning signs of cancer. Almost all recognised an unexplained lump or bump. Almost 90% recognised a change in a mole. And symptoms that were less likely to be recognised included unexplained night sweats, so that was less than 20%, feeling full very quickly, or bloating, approximately 30%. And to be fair, I think those are things that probably, unless one had a relative that had experienced some of those types of cancers, like the lymphomas and ovarian cancer, that may not be as familiar with it. Women were more likely to correctly identify cancer signs and symptoms than men in general. And older people, over 55 here, were more likely than younger people to name several signs and symptoms of cancer. Again, possibly going back to having looked after people, you know, in their family who'd experienced cancer. If concerned about a symptom, most, 60%, would discuss it with their doctor, with their GP first. Just in relation to views on barriers to presenting to GPs, almost 40% identified talking about their symptoms with the receptionist, and that definitely came up again in relation to, you know, our discussions when we were going around doing the training, and also in the qualitative interviews. Approximately a third were worried that they would be told about what they would be told in relation to bad news and the possibility of needing more tests. And almost a third reported getting difficulty getting an appointment at a particular time or with a specific doctor. Approximately 20% reported the doctor was difficult to talk to, or were concerned that their symptoms would not be taken seriously. Other things identified, but this is by less than 20%, included cost, being too busy, and having had a bad experience in the past, and not feeling confident talking about their symptoms. So they were there, but much identified by a much lower proportion. Just in terms of cancer screening, in the main, there was fairly good uptake across the 3 cancer screening programs, particularly for breast and cervical screening. Uptake for bowel screening was lower, as is the case for non-travellers, although the numbers were on the small side, so it is difficult to have certainty there. The main barriers were things like embarrassment, fear of results, not receiving an invitation. Those were the main ones. And facilitators were, again, talking to the traveller community health workers and receiving an invitation. Now, so just moving on to the qualitative findings. These are the interviews with the healthcare professionals and what their views the reviews of barriers and enablers. So we identified 4 themes. So the first one is that the social determinants of health basically affect everything. They affect cancer prevention, screening, and timely reporting of warning symptoms, particularly for those living on halting sites. Health system barriers include difficulties relating to accessing health services and lack of cultural sensitivity within the health system. And certain individual and/or cultural barriers affect cancer prevention, screening, and timely reporting of worrying symptoms. So some of the healthcare professionals had mentioned, just to flesh those out a little bit, in relation to the social terms of health, that there is so much a focus on the day-to-day and having to prioritise other issues, particularly if there was housing instability, accommodation, substandard accommodation, all of those issues that we will hand over to our colleagues here that can elaborate on it further. But it basically did affect everything in relation to being able to adopt healthy lifestyle behaviours and exercising, safe areas, all of those things. So enablers to the uptake of healthy lifestyle behaviours, cancer screening, and timely reporting of cancer symptoms. So helpful things would include a whole of government approach to address the social determinants of health, including discrimination. So just many examples just in relation to discrimination right across the board in terms of housing, employment, even things that I suppose mightn't come to mind straight away would be things like if a person wanted to join a gym, that they might be concerned about experiencing discrimination in that context. So that very much came through across everything. And in relation to, employment as well, if a person isn't employed, that they may not be able to have the water cooler moments again, that people would be able to chat about, well, have you gone for your screening or whatever. So all of those issues really coming together and impacting in this context. Another important point made was the providing more practical on-the-ground support and the introduction of an ethnic identifier to determine equity in service provision. Additional enablers include ensuring the primary healthcare traveller projects and traveller community health workers are adequately resourced. I'm just going to hand over now to our colleagues. So this was just in relation to the main themes coming through the interviews with the travellers. So things like life is hard enough, again, the demands of every day today, and some of the other issues there. So I will hand over and let you take it.
Sorry, thank you. There's loads of figures that come up there, but my brain is not working the way it used to. I'm getting a bit older now, so I forget some of them, but one of them in particular there, I was just looking at the figures that we got in the survey, and a lot of people, they said if they had cancer they wouldn't like to know. Now that was high, and I think the reason for that in the community, like my mother died in her 50s with breast cancer, and she died and she got no chance to live. But since that, 3 members of my immediate family was diagnosed with breast cancer. And the fears that was in us at these times, but there was older members like myself that said, well listen, that's 30 years ago. There's more advanced stuff now and you're caught early so they can deal with it better. So I think that's the reason why that was high, because if I did a survey, I probably would have scored a high as well, because it's a very difficult thing to go in when you have experience of somebody dying so young. It's very difficult to go in and to listen to a doctor because you're expecting the worst, even though deep in your heart you're saying, well, it's 30 years later, so probably it'll be better. The other thing was, it was very important that we as travellers did the survey, because we had built up the trust, and people, the travellers, our own community knew us, so we were able to ask the questions, and we were able to also kind of elaborate on the questions, make it more simpler if there was one that they didn't understand. So that was very good, and also because we don't have an ethnic identifier, it was kind of better that we went and done the traveller community, our own community, because we knew that it was all our own community. So that was another one. The other thing was, I have to write bullet points here because I don't forget. The travellers' experiences, a lot of them wanted to talk about it because there is high cancer in our community. There's cancer everywhere, in other communities as well, but we're one of the communities that would have it higher than the norm, as they say. So that was very good, and we got very good feedback and very good attention, and I think that was one of the very good reasons why the numbers were up, because it was a very high uptake. So I think that was one of the reasons.
And I think
so I'm going to give it to these 2 girls now.
I think we got a high intake because a lot of the ones that was going out was women, and us as mothers, we're aunts, we've got children of our own, and we were trying to keep down the fear, but also say how important it is for the 3 screenings to be taken up. And I think in our community, the cervical screening is one of the highest. Do you know, since we've been going out ourselves and doing it. And it's just that we're a small community, and we know everybody nearly in it, and we can see the high percentage of cancer within our own community. It's not that it's not in any other community, but we see it, and we kind of say that we need to go and get ourselves seen to, get ourselves checked, and that these screening services is there, and they're for free. Now we do go out, like we done the bowel screening. The difference with the bowel screening, that we went out and learned some within the community how to use the kits, how important it was to get the results back in before a certain amount of time. We have a lot of people with literacy problems within the community, so we fill out the registration, even though we explained to some of them that there's a free phone number and a free register. Some of them wouldn't know how to do it on the phone, so we done it for them, and we got the results back in. And when we went out, some of them would be afraid to read the results, so if they wanted you to, we'd read the results for them, you know, and if it was a negative, we were there as well, you know, so it was always, and it wasn't family, so if they didn't want family to know, we were there, and it was confidential, you know what I mean, till they were ready to do whatever they wanted to do. And it's just that this is the leaflets that we provide is Traveller Pacific, and on the Bowl one, it's members of our own community, so as soon as a traveller sees it, they know like who's on, that's to do with travellers. And this is the newer one because the age was taken down, like to 59. So this is the newer one that we have at the minute.